contaminates food and contaminates water. As a result, we get food scarcity, which what does that do? It increases food prices, making people more at risk for food insecurity. Consequently, there are greater incidences of diabetes, stroke, hypertension, and heart disease. As a podiatrist, I see the foot health effects: worsened diabetic neuropathy, more advanced circulation problems, non-healing wounds, which leads to gangrene and amputations. The most vulnerable populations are the populations I serve, being in a federally qualified healthcare center. Black, Indigenous, people of colors, that's what BPOC stands for, people with disabilities, the old, the young, the LGBTQI plus communities, those are the vulnerable populations. Consequently, greater access is needed to help for healthy food for these vulnerable populations. Next slide, please. My key actions over the last 10 months have involved 3 sections: food, education, and community involvement. I am in the process of organizing a program, a food prescription, just like you go to the doctors and the doctors gives you a prescription for ibuprofen. Well, instead, those vulnerable populations get a prescription for fresh fruits and vegetables. The patients are referred by either their health insurance or they're referred by their health care providers. A food insecurity questionnaire was also instituted in my institution. Also, to help with food insecurity, I've established a farmers market to come to our clinic. And there were lots and lots of meetings that are held and are being held to establish this program. Patients who are at risk for food insecurity are also given a list of institutions around the city that give out, like pantries or whatever, that give out fresh fruits and vegetables at low or no cost. Educationally wise, I've attended a DC Food and Medicine. Also, I am in a food medicine program through the Academy of Lifestyle Medicine. Additionally, I gave 2 lectures at the NMA prior convention in New Orleans. I also was able to be blessed to give lectures at my, in front of my providers at my job, as well as the Rotary Club. I also was a facilitator for the 2nd-year students at the Milwaukee College of Wisconsin Climate Health Change Program. With regards to the community, I've testified with the EPA. I authored 2 NMA resolutions in the House of Delegates and published an op-ed in the Madison Cap Times. Next slide, please. My next steps involved bringing fresh pigs mobile markets to all of the Wisconsin FQHCs. Additionally, the food prescription program, which I've started at my clinic and a sister clinic, I would like to expand that to statewide so that all of the FQHCs would be eligible to be involved in that program. I'm also identifying funding sources for the food prescription program, and I want to bring a cooking-based nutrition education. I am also slated to be a lecturer for the family medicine residents at our clinic. Additionally, I do plan on participating or continuing my participation, I should say, in the Healthy Climate Wisconsin, as well as the Medical Consortium. I also plan on being a speaker. I want to thank Dr. Mark Mitchell, who is the originator of this wonderful program, all of my advisors. Thank you so much for this opportunity to learn these last 10 months. Thank you for your attention and have a happy holiday. Thank you.